So I want to go over some common tips and suggestions and ideas for doing the most effective exposure that you can. Remember, just doing it or trying it in some way is half the battle there. So if all else fails, just give it your best shot and then circle back and talk about it with your therapist and figure out ways that you can improve the exposure that you're doing. Nonetheless, I want to try to give you a few tips to remember as you're starting to do your exposure. Number one, and maybe one of the most important ones, is to make sure that you stay in that exposure as long as you can. You've likely talked about this with your therapist when you were designing this homework practice, but it's really important that you try to stick it out as long as you can. Usually we say if you can, try to stay in that exposure practice for anywhere from 45 minutes to an hour. But depending on the activity, everybody's situation is a little bit different. Even staying in for 30 minutes as opposed to 15 minutes is going to be important. Related to that, what's really important is that no matter what, you don't end the exposure early because you're feeling too anxious. Remember, you want to allow for habituation to happen during your exposure. So therefore, it's really important that no matter what, you don't leave your exposure when you're at your peak anxiety around the activity. So you really want to make sure that you stay in it and not end it early due to feeling anxious. If you do that, the problem is that you might actually make yourself a little more afraid of the situation in the long run. Another thing to remember that's really, really important when you're doing these practices is to try to reduce, if not completely stop, any rituals or safety behaviors or avoidance-based behaviors that you may have done in the past. So you might want to review some of those behaviors as you've discussed with your therapist, just to make sure that you're not doing them, even if they're subtle, because again, this can end up sort of blocking that process of habituation and disconfirmation that we're really looking for in the exposure practice. And then lastly, I want to remind you that repetition is so important. So it's really great if you do it once. It's even better if you do it 2, 3, 4 times before your next session or before your next planned scheduled appointment. So just make sure that you repeat it as often as you can. Because what we actually know from research is that one of the best predictors of a good treatment outcome actually is, in fact, repeating that practice on your own. So it's good to do it with your therapist when you can, but it's even better to be doing it as often as you can on your own, as well as in varied situations. So again, depending on the activity, you want to repeat that exposure in as many different ways as you can and try to challenge yourself every time you repeat that exposure practice. So hopefully these tips and suggestions will kind of help you get started with doing that exposure. I want you to feel confident and really kind of take on this challenge. So remember, you can do this. It just takes a little bit of time and it takes a little bit of repetition, just like with any skill. So hang in there, give it a shot, and when you're done, you can always talk more about it with your therapist.